am Agatha Mamaril from BSN 1B, and today I'm going to perform applying and removing sterile gown and sterile gloves. But before that, let us first define the purpose of properly applying and properly removing the sterile gowns and sterile gloves. First is to enable the nurse to work in sterile areas and to work close in sterile field. Also, to protect the client from being contaminated with microorganisms from the nurse's hands, arms, and clothing. Now for the assessment, assess the client's records and orders to determine what exactly procedures will be performed that requires a sterile gown and sterile gloves. And of course, check the client's records and ask about the latex allergies. Use non-latex gloves whenever possible. For the planning, think through the procedure and plan which steps should be completed before the gloves can be applied. Assemble equipments and supplies such as sterile pack containing sterile gown and sterile gloves. Prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how he or she can cooperate or participate. Discuss to the clients how the results can be used in planning, care, or treatment. After performing hand hygiene, make sure that our hands stays above our waist and to properly dry our hands using a towel. Before getting the towel, make sure that we are 12 to 18 inches away from the table, and let's bend our waist a little and then grab the towel. Make sure to dry our hands in circular motion. Then stop until we reach the elbow. After that, let's unpack our sterile gown and sterile gloves. First, unpack the sterile gloves. Next is unpack the sterile gown. Applying sterile gown, first is to grasp the sterile gown at the crease near the neckline, holding it away from you and permit it to unfold freely without touching anything including our uniforms. And then, put our hands inside the shoulders of the gown. Forward, and then have our co-worker to tie the neckties and pull the gown upward to cover our neckline. Sterile gloves, first is to open the wrapper with our hands still covered by the sleeves. And then use our non-dominant hand to pick up the opposite gloves by our thumb and index finger. And then let's put our hands inside the gloves. Putting our hands inside the gloves, let's pull the sleeves. And then use our dominant hand to grab the opposite gloves. The proper applying of sterile gloves. Now have our co-worker to tie at the back of the gown. Make sure to not touch the front of the gown because it is considered sterile. Okay, after the procedure, let's remove the sterile gown and sterile gloves. First is to remove the sterile gloves. And then inside the sterile. washing. Remove and dispose of used gown and gloves. If appropriate, document sterile technique was used in the performance of the procedure. For the evaluation, conduct any follow-up indicated during your care of the client, and then ensure that adequate numbers and types of supplies are available for the next healthcare provider.
Seeing eyes of mine, you see, there are no trees inside of me. In this sense that I can look at